Imagine sitting in a sterile, dimly lit hospital room. The rhythmic, mechanical beeping of the monitors is the only sound breaking the silence. In the bed next to you is the person you love most in the world, and they look smaller than usual, fragile. Suddenly, the door swings open and a team of doctors rushes in. They start using medical jargon you've never heard before, clicking through charts, talking about your loved one, but not to them. Your heart drops. You have a dozen questions, but your throat tightens. You feel completely powerless. If you've ever felt that suffocating wave of helplessness in a doctor's office or in a hospital room, I want you to take a deep breath. See, here's what's important. You're not powerless. In fact, in that room, you are the most important person there. You are their voice. You are their protector. Today, we're going to talk about how to advocate for your loved ones in the medical system, even when you're terrified, even when the doctors seem intimidating, and even when the system feels broken. I'm going to give you the exact framework to shift from a helpless bystander to a powerful, respected patient advocate on the walkthrough.
Welcome to the walkthrough.
The biggest mistake most people make when stepping into a hospital room is thinking they have to go to war. We've all seen the movies where someone screams at a doctor to get things done, but in reality, aggression builds walls. To save your loved one, or to save your loved one's life, you need to learn the art of collaborative advocacy. Doctors and nurses are human beings working inside a severely strained system. They're exhausted, and when you approach them as a partner rather than an adversary, everything changes. But how do you do that when you're running on 3 hours of sleep and pure panic? Well, you start by establishing yourself as the historian. Doctors see a patient for 10 minutes. You have known them for a lifetime. You know their baseline. You know when their smile looks forced or when their confusion isn't just old age. It's sudden medical change. Your institutional knowledge of the person you love is just as valuable as the doctor's medical degree. Never forget that. Now, keeping track of all this in the middle of a medical crisis can be overwhelming. You can't rely on your memory when your adrenaline is spiking. And that's exactly why I created the Patient Protection Blueprint. This is a comprehensive, step-by-step ebook that's designed to be your brain when you can't think straight. It includes medical history templates. It also includes daily hospital logs, specific scripts on exactly what to say to a doctor who isn't listening to you. You can download it right now if you click on the link below using the link below. Keep it on your phone and print it out. Just make sure you have it before your next doctor's appointment, okay? So let's move from the hospital to the doctor's office. The average clinic visit lasts less than 15 minutes. If you walk in unprepared, that time evaporates and you will leave with a handful of prescriptions and a head full of confusion. So to advocate effectively in a clinic setting, you must dominate the pregame. And what does that mean? Well, the one-page summary. Never hand a stack of loose papers. Create a single-page listing of current medications, primary symptoms, and the top 3 questions you need answered today. Next is the scribe method. If you are accompanying a parent, spouse, or a child, your primary job isn't to talk, it's to write. Your loved one should focus on the doctor, and you should focus on capturing every word. And here is the phrase that will completely change the dynamic of any doctor's appointment. Write this down, please. Here's what you say. Doctor, we want to make sure we are compliant with your plan. What is the single most important thing we need to watch for at home? And at what point do we call your office versus going to the ER? Now, look at what that question does. It tells the doctor you are on their team, but it forces them to give you clear, actionable guardrails for your loved one's safety. But what happens when the worst occurs and your loved one is admitted to the hospital? This is where advocacy becomes a marathon. Hospitals are complex and they're rotating ecosystems. Shifts change every 8 to 12 hours. Doctors rotate weekly. Information gets lost in the cracks. And to keep your loved ones safe, you have to become the anchor of that room. So first, learn the names of the daytime and nighttime nurses. They are the gatekeepers. If a nurse likes you, your loved one gets better care. That's just a fact. Bring them a coffee. Say thank you. Little things like that mean a lot. Second, understand the chain of command. If you feel like a doctor is making a critical mistake or ignoring a life-threatening symptom, screaming won't help. You need to know who to call. And every hospital has a charge nurse. They also have a unit manager and a patient advocate liaison. If you hit a wall with an attending physician, you calmly and firmly say, "I would like to speak with the charge nurse regarding a patient safety concern." Those words are a beacon. They trigger internal protocols that get eyes on your loved one immediately. There is a silent danger in healthcare that most people don't see coming until it's too late. It's called the discharge. Hospitals are under massive financial pressure to clear beds, and sometimes patients are pushed out before they are stable or before their family is equipped to care for them at home. Imagine bringing your elderly mother home or your elderly father home only to realize you don't know how to clean her surgical or his surgical wounds. You don't know how her oxygen tank is to be handled, or her oxygen tank hasn't even arrived, and you don't know which medications to stop or start. Within 48 hours, she's back in the ER. As an advocate, you have the legal right to appeal a discharge if you feel it's unsafe. This specific transition, moving from the hospital back to the home, is where the most critical, life-threatening errors occur. And so inside the patient protection blueprint that I've created, I have dedicated a few sections to what's called the Safe Discharge Checklist. It gives you the exact questions to ask the case manager. It gives you a checklist for medical equipment and for delivery of that equipment and a medication reconciliation log so you don't accidentally double dose your loved one. Don't wait until the social worker enters the room with a stack of discharge papers to figure this out. Click on the link below and get your copy of the Patient Protection Blueprint. Do that so you can protect them when they are the most vulnerable. I want to stop here and talk directly to your heart for a moment. I know what you're thinking. I don't want to be a bother. I don't want the doctors to think I'm difficult. What if they take it out on my family member? Been there, done that, understand. But listen to me closely. Polite silence does not save lives in a broken medical system. Your fear of being a nuisance is completely normal, but you must trade that fear for love. If you are polite, respectful, organized, and firm, you're not being difficult, you're being effective. If a medical professional makes you feel small for asking a question about your loved one's life, that is a reflection of their ego, not your worth. You have permission to take up space. You have permission to ask why a medication was changed. And you have permission to say, "Please wash your hands before you touch my loved one." You didn't go to medical school, and you might not know how to read an EKG. Neither do I. But you know the person in that bed. You love them, and that makes you qualified. You're entirely capable of navigating this system. By staying calm, organizing your information, working with the medical staff, and standing firm when things don't feel right, you can drastically alter the outcome of their care. You might literally save their life. If you want to walk into your next medical appointment feeling completely confident, entirely organized, and ready to protect your family, click the link in the description below. Now, if you want to download the Patient Protection Blueprint. It's a small step you could take today to ensure peace of mind tomorrow. If you find this video was helpful to you, please hit that subscribe button. Leave a comment, write your own caregiving experiences in the comments below, and share this video. It might be someone you're caring for, it might be an aging parent, or it could be a sick loved one right now that needs to get this information. Thank you for watching. Thank you for loving your family so deeply. And remember this, you are the best advocate. I'll see you in the next video. Blessings.